Welcome to the Eye on Annapolis Local Business Spotlight. There are thousands of locally owned businesses in the area, some small and some large. Some you may know and others you don't. But one thing they all have in common is a great story, and we want to share it with you. Join us every Saturday as we talk to the founders, the owners, and the managers of local businesses you have come to know and love, and those you will come to know and love. Now here's your host, John Frenay, with this week's Local Business Spotlight.
Well, joining us on the phone, because we still can't really safely do it in person, is Dr. Ndidi Harley, who is with HealthSource in Crofton, which is a chiropractic practice fairly new up in Crofton, right?
Yeah.
Right. Well, first of all, thank you very much for your time. And for those that are interested, I'll get this out here periodically throughout the time we talk, but also right away. But you want to go to healthsourcechiro.com/Crofton, which is the website for HealthSource in Crofton, and Dr. Ndidi Harley. Tell us a little bit about HealthSource. What is it all about up in Crofton?
Yeah, thank you. Thank you so much, John, for having me today. HealthSource is, we are a franchise, and it's headquartered in Ohio. I'm actually the first one to open up the franchise here in kind of that DMV region. But the HealthSource is actually one of the largest, or is the largest chiropractic franchise. There's not a whole lot around. So, and the reason why I've kind of opened up one here is because we have a lot of people that work really hard to, really study and get a lot of evidence-based research to us, as a practitioner, focus on and keep up with the most recent research. So it's really nice to have, a lot of the products that we carry, a lot of the services that we offer, and something that will actually help out the patient and keep the patient healthy and get them back to what they do. So we are a franchise. But
Well, I will say that I know that a lot of our listeners, and actually to myself, I'm not a big fan of giant corporate entities. And there's a sort of a misnomer with franchises. Because some people are like, oh my gosh, it's the big corporate, beast somewhere and everything else. But franchises are a little bit different. And I realize that they are national, maybe even global brands. But and there is a big corporate overlord, if you will, but they're really designed to help set the smaller ones for success, such as HealthSource Crofton. And Dr. Harley lives in the community. She practices in the community, although I don't know why they call doctors practicing. I'd rather have you get it down and not have to practice anymore. But, you're employing local people. You're taking the money that you make and you're putting it back into the local economy here. So it's not like, okay, we're writing a check to Best Buy and it's off to Minnesota here. So
exactly.
This is, and that's just, I want to make that clear to everybody because I am a big proponent of businesses starting on Main Street and whatever Main Street may be, but small business, locally owned businesses.
I love that you pointed that out, John, because I think also I'm not a huge fan of franchises, but I personally did a lot of research with HealthSource, and I think even visiting each of the different clinics that I've been to, just all around the U.S., there's a personality to each one. It's not like you're going to a McDonald's, right? Every doctor has his or her specific training and brings all of that education and expertise to their own specific clinic. So I think, in this instance, HealthSource is, again, helping with, backing us with the research, backing us with, making sure that anything that we offer in the clinic is evidence-based and will help the patient as a whole. So, yeah, but sure. I am glad you mentioned that.
It's a little bit of a vague thing, but I just want to make sure that that's clear, that this is, I'm not talking to somebody in some headquarters there. But how did you get into chiropractic medicine here? What was the interest on this?
Yeah, that's such a great question because, I think, starting out or growing up, my dad, who's now retired, he's medical doctor, and my mom was a nurse. Sisters or nurses or scientists, all in the medical field. But I kind of had no choice but to look into the medical field as a career. But I was actually going to be a dentist, believe it or not. And, taking all of my exams and wanting to get into University of Maryland, when that summer I actually got into a car accident. So that car accident kind of changed the trajectory of where I was heading, because it was a pretty bad car accident. 16-year-old kind of T-boned my vehicle. I blacked out, and it was horrible. So for 2 months, I was having massive headaches. I was having, just a lot of, the aches and pains that anyone who would have been in a car accident would experience. But of course, being in traditional medicine, my dad obviously gave me medications, which I was not, I'm not a person that loves to take medication. So didn't comply, obviously didn't get better. And by chance, my mom took me to a chiropractor in Silver Spring, actually, Dr. Kaminsky. And he adjusted me. And before that, I had no idea what chiropractic was. So this was my first experience walking in. It was, aesthetically, it was like, is this a doctor's office? It's not white walls. It's not cold. It's welcoming. Everyone is friendly. So he adjusted me a few visits, and most of those headaches that I was having, a lot of that neck stiffness that I was having, was completely diminished, right, by the third visit. And so that really opened my eyes up to kind of looking into what chiropractic is, because no one really talked about it. Long story short, I ended up interning for him and, read Chicken Soup for the Soul, I think is what it was called.
Right.
About chiropractic, and a lot of athletes that, you're really, really were proponents of chiropractic care. And and that end of the summer, that fall, I was heading to Palmer College of Chiropractic in Florida. So it's a huge, huge change. And my dad was not happy with me. But
why was he not happy with you? It's not real medicine or something like that? Or is it?
My dad also thought dentists weren't real medicine, doctors, that they failed out of med school, which is so sad to say, but just very strong opinions, and not knowing or not being educated in that that practice of care. So he just didn't know a lot. He didn't know too much. He wasn't excited about me going to dental school to begin with, and so chiropractic school was a huge stretch for him.
That's I don't mean to laugh. That's a pretty funny story, because I know you've heard the arguments between like MDs and DOs, doctor of osteopathics, right, and stuff like that, and they're like, well, this and that, and it's so funny that you've got that career competition going on between. So funny. What all does chiropractic? I mean, you mentioned headaches, and when I think of a chiropractor, I think of, okay, I woke up with a stiff back this morning. What do I do? What chiropractic medicine get its tentacles? What all do you do?
Well, I think chiropractic is, I see it as a holistic look at health. It's not. I think the common, there's a common notion that, yes, if you have neck pain, back pain, chiropractic care could be helpful, but it's more than that. I don't know I've lost count of how many patients that come in just for migraines, or just for, trouble going to the bathroom. It's a holistic look at health, right? You're not going to feel everything that's going on, and it's more like, do you want to be proactive, or do you want to be reactive and wait for something to occur to happen? So yes, we do help with all spinal related issues, but we also help you stay healthy. I mean, if you think about it now with COVID, a lot of people, are not, they didn't plan to work from home. Right. Hence, ergonomic setup of, their workstation is not ideal. And with that, yes, they may have aches and pains, but imagine the nerves that are being compressed from poor posture, from, just repetitive postural changes that could maybe not cause immediate symptoms right now, but maybe later on down the line. So, chiropractic here looks at a patient holistically. You can have foot pain, you can have spinal pain, you can have headaches, you can have trouble sleeping. It can help with any of those and more.
Interesting. I mean, you're absolutely right with the work at home. I know my daughter is working home out in North Carolina, and I said, girl, don't skimp on the chair. I mean, seriously, pay $300-$400 for a chair if you're going to be working, 6 hours or something like that. I said, you're going to thank me for that, because I've heard of so many people like, I'll just like pull up the kitchen chair and do it, which might be fine for a couple hours, but not certainly for any kind of long term. And it's funny you mentioned about the different symptoms that evolve in that. And I remember it's probably about a year and a half ago, I went out for a bike ride down in I guess the Mount Vernon Trail out of Alexandria, and the next day I woke up and I was like, I had this horrible, what I thought was chest pain. And I go to my doctor and I'm, oh my God, I'm having the big one. It's the hardest, you got to do something. And he looks at me, he says, it doesn't seem like it. It doesn't seem like it. And he put the EKG on. There was nothing crazy there. And he says, where's there? And it didn't even feel like it, but I had pinched a nerve in my central back, he had thought. And, that was something and he had recommended that, either try to ride it out for a day or two and see how it goes. You can take some Tylenol and stuff like that. If that doesn't work, then you can turn around and go to a chiropractor. And if that doesn't work, then, you can get into some sort of a physical therapy type of a thing to make sure that it, gets done. But I was, I didn't even think of my back being hurt. It makes sense now that I was hunched over riding a bike for, 12 miles or whatever it may have been. But, and again, it manifested as it, I get the question, like, did it feel like an elephant sitting on your chest? I said, that's a stupid question because I've never had an elephant sit on my chest, so I don't know what that feels like. I mean, it's all I can tell you is it hurts and it feels like it's in my chest. So just that's where we are at this point. I want to come see you and let's put the machine on me and figure out what's going on. But that's kind of funny. I was looking at your website. I mean, you've got, and I don't know what this is, but cupping and you treat pediatrics and everything else. I mean, you're really kind of treating the whole family here, right?
Yeah, exactly.
What is cupping?
Yeah. Cupping is a very ancient technique. But, in the office here, like acupuncturists use it, a lot of practitioners use it, but I use it more so for soft tissue decompression. To release what's called a fascial layer of, around the muscle. It's one thing to stretch out the muscle and help decrease tension around the muscle, but if that fascial layer of the muscle is still pretty, kind of constricted or restricted, then that patient might still be in pain and lots of those symptoms might remain. So it's actually a very fast-acting technique, which we use suction cups to basically suction the specific area of complaint. And we do different exercises, range of motion exercises to help with that suction effect. It does leave some discoloration or, round circles. I don't know if you guys, if you've probably seen this around. I think Michael Phelps had it in one of his past Olympic.
Oh, yes. Where he had like the little, look like crop circles.
Exactly. Exactly. So that's the residual effect of that. But I mean, almost, for most patients that I perform that on, their pain is decreased, range of motion is instantly increased. So it's very, very effective. And it feels strange, but it's not painful at all, but very effective for soft tissue work.
Well, who is your patient? What people come to you? Is this, I mean, I've woken up in the morning.
Everyone.
Well, yeah. Well, I mean, if I wake up with a crooked back and it's really bugging me all day, I mean, my, 58 years of life has told me, just get up, deal with it, and work it out. It'll work itself out throughout the day and everything else, which it typically does. But I mean, is that something that you would treat? Does that merit a call to you, or do you just walk it off?
Absolutely. I I don't think you should, I wouldn't recommend walking it off, because I think your body gives you signs, right? Signals, signs. It's just up to you to listen to it, right? It's gonna call, eventually it's gonna scream, right? Do you want it to be where you're, I had a patient literally maybe about 2 months ago come in, a young guy, IT guy. He's sat all his life, and his wife just had a baby, and I think coupled with the repetitive motion of lifting a baby out of the crib, his back, quote unquote, gave out, right? So he came to me and he said, well, I've had stiffness, but I've never had any back pain. So this is something we can fix really quickly, right? No, the guy actually had a disc herniation. Now, was the disc herniation from just him leaning over to pick up his baby? No, it's been happening in his body. Whether it's pain or stiffness, that's still a sign of dysfunction, right? So all of those years, all of those hours of repetitive sit-in and lack of motion into the spine actually compressed the discs. And so it was kind of that perfect storm. He bent over, he rotated just a little bit and tried to come up, and there you go. It was a herniation. So I would say be proactive. If you feel aches, if you feel, mild stiffness, you still should check it out and see. It's better to treat it early than later.
Right. Now, would HealthSource be a precursor to surgery? I talk about slip discs and stuff like that. Typically, I know that that is a surgical procedure that can correct that. Is this a precursor, like, hey, before we put you under the knife, let's see if we can't resolve this with HealthSource? Is that?
Yeah.
Okay.
I've had referrals from doctors who wanted patients to try out chiropractic care before they had surgery. I'm not going to adjust a disc herniation, right? So a disc herniation is where the disc itself, which is kind of that almost like a gel-like substance in between the bones of the spine, actually, right? So there's no chiropractic adjustment that can fix that, but we do have a technique called spinal decompression, which in a way kind of vacuums and suctions out or suctions in the substance and removes the pressure from the nerve and so forth that could be causing the pain and inflammation in the patient with disc herniation. So there's spinal decompression would be a way to go in terms of a treatment protocol for a patient with a disc herniation. And lots of studies have actually shown that it's prevented surgery from some of those patients. Now, is it going to work for 100% of patients? Absolutely not. There's a lot of history, a lot of other complications that, we look at to determine if a patient is going to respond well to spinal decompression. Some patients might just need surgery, but we evaluate and we make sure that patient can have at least 70 to 80% or more of a positive response to that decompression treatment. So that would be a route to go for any patient with a disc injury. So disc protrusion, disc herniation, and so forth.
Interesting. So, but you've got, chiropractic is all sort of centered around the bone, correct? Is that? Or
ideally, yes. Yeah.
So, you get into the shoulders. Somebody's got what might ultimately be the Tommy John surgery, the rotator cuff replacement or something like that, or, neck pains or the, old knees, and whatnot. This is all stuff that you can possibly, take a look at prior to making this leap into a surgery suite.
Yeah. Not everyone needs surgery, right? I think surgery is almost kind of like a last resort, or it should be. So, yeah, yes, you're right. Chiropractic is centered around the spine, but I think with, again, kind of progressive. So HealthSource, we're not just chiropractic. We are progressive rehab. So anything that can help a patient, because I think a lot of times you don't realize that where you have the injury, it's probably not where the origin of the injury began. So, a patient with shoulder pain or rotator cuff pain could have had issues with their neck or their upper back, right? It's all kind of that, that biomechanics of movement. So, if we're able to release a lot of those locked segments in the spine, if we adjust the patient's mid-back, for example, that's going to actually help with the motion of the shoulder, believe it or not, along with even maybe their hip. So it's a holistic look, and we're adding all of these researched, we call it modalities or treatments to help along with the adjustment. So the adjustment is the primary goal, right? Because if that's not, aligned, then the rest of the body will compensate, right? Whether you feel it or not.
Right.
So once we get that alignment going, then we can treat all the other areas that have been affected, so cold laser or deep tissue laser treatment is something that we can use for like a shoulder injury, a knee injury, post-surgical knee or shoulder, lots of things. But we add all of these modalities to help that patient, get the best care possible.
Interesting. Now, and I guess the other question sort of leads into that is, this is not strictly just for, can I come in? I'm sure I can, but do you find that people are using you more like and pardon the analogy, but like a hairdresser, that I'm coming in every 6 weeks or whatever it is to get my, haircut or dyed or whatever it is? Or is this something that you come in, hey, I just need to work on this one issue and we get it resolved and then I go away forever until something else happens? Or is it a combination of both?
I think that's our goal. My goal is to help that patient get better and stay better and get back to, living their life. Now, I think if I had a yoga instructor who has perfect posture, who doesn't sit for several hours every day, who, is very aware of their body, then that's different. Yeah, that patient can come in once every few months to get adjusted. But I think the reality, especially with the pandemic, is that we're not moving as much as we need to, and, posture changes and all of that. So that makes it a little harder for me to say, okay, well, this patient will be perfectly fine, just get in one adjustment and then that's it. No, I think for most people, you do have to, it's more of a lifestyle, just like working out at the gym. You're not just going to work out once and you gain your muscle mass and you're super healthy and you stop. So, it could be, I think for the ideal patient, for most patients, I think once a month, if they don't have any complaints, should be sufficient. But again, every patient will look at their lifestyle and what they're doing, past medical history and so forth to better determine that.
Sure. Well, I know it's funny. I just noticed on my iPhone and the Health app, which is getting creepier and creepier as the days go by. But I was out for a hike down at Calvert Cliffs Park, and I happened to notice that it measured.
Oh, I love that.
Well, it measured how much I favored one foot or the other. It was like the time on one foot versus the time on the other. And I looked into how they measure it, and they said, well, yeah, this could be, again, jumping into the spine. It could be throwing you not necessarily off balance like trip and fall, but getting you out of alignment and out of balance. That if you're favoring to have one foot on the ground, I can't remember what it was, but it was like if you have equal time with the feet on the ground and off the ground, that's ideal. But if you have one foot on the ground more often than the other, and I'm like, okay, this makes sense to me. And as you look at the spine, it just seems to be the central, the nervous center, which it's, not medically, but it's everything comes from it. You've got the ribs, the back, the head, the neck, the feet, and everything else there. Do you guys take insurance? Is this an insurance type of a?
Yeah. We are. Yep. We're in network with a lot of the local insurances here, Blue Cross, Cigna. Yep.
Yeah. I'm sorry to hear that. That's, I've heard from so many doctors. It's like, the one thing I could get rid of my practice is just insurance. It's just so time consuming that it takes you away from the core of what you really want to
is.
do, but it's a necessary evil.
Yeah.
Again, we're on the phone with Dr. Ndidi Harley from HealthSource in Crofton. It is HealthSource Chiro, which is CHIRO.com/Crofton. You stand ready to tweak us, twist us, poke us, and get us all back into a comfortable shape as we get older. And this is, obviously this is something that somebody of my age, I'm much older than you, I think, but would be interested in, but really any age that you do. I mean, I would imagine that athletes that, high school athletes could probably
Absolutely.
some different things as well. And obviously you had mentioned earlier that you do work with other doctors that refer people to you to try you first. And I'm sure that you get into finding a patient and says, yeah, there's not much let's try this for a month. And if I can't get anything out of it, if we can't move on it, let's, consider back. Yeah. Which is unfortunate. How long have you guys been around?
So HealthSource has actually been around for quite a while. I've been in practice for, this is my 11th year in practice. So
wow.
I can't believe it's been that long. Yeah. So, but HealthSource has been around for quite a while. I actually can't remember now.
Have you always been with HealthSource?
No, I haven't actually. No. So the funny story is that I actually had my private practice before I kind of joined with HealthSource and then expanded the practice. But we actually had our grand opening exactly a year from this month. So
obviously your sense of timing is...
I know. We had a wonderful grand opening, and then 2 weeks later, the pandemic hit. So, yeah. So this specific location here in Crofton is about a year in, this month. So,
well, you guys are located at 2101 Concord Boulevard. That's sort of right behind the diner, isn't it? In Crofton?
Is. Yeah.
Let's see. Is Chesapeake Bay Roasters still back there?
It is. Oh my goodness. Yes. They were actually looking to get into the building that I'm in right now, but I don't know if that's worked out or not.
Now being right there and where this is at the intersection of 424 and Route 3 in Crofton. It's just south of 424, and then you take a right into it and it jumps you right back in there. But as you're down there, have you been to Ashling Kitchen to eat?
I have.
Aren't they great?
Amazing. Yeah. Happy hour is awesome. Although we haven't had that in years.
That was a fairly late discovery. I mean, I know they've been around for about 18 months as a store, and I just discovered it probably about 7 months ago. And I'm like, oh my gosh, because we had gone up actually to Chesapeake Brewery to watch a movie, and it got rainy, it was miserable and everything else. And I said, okay, let's just go over here and get dinner. I've heard it's good. Oh, it was fantastic.
Oh, so good. Yeah.
You got, and
so good.
And I understand, and I've not been there, but I understand there's a great pizza place across the street in Frank and Luke's Pizza over in the Giant Shopping Center. I had a friend of mine that's from New York, and he says, oh, this is the real deal. I'm like, okay, we'll have to remember that.
Really? Well, I have to try them out. I haven't tried them yet.
Fantastic. Well, I won't take any more of your Saturday afternoon, but Dr. Ndidi Harley from HealthSource Crofton. Again, it's healthsourcechiro.com/Crofton, and there will be a full link in the show notes with all the contact information. If you've got a crick and you're a little bit crooked, I think this might be a good place to figure out what's going on and get it taken care of. But I appreciate all your time this afternoon. And
absolutely. Thank you so much for having me.
Well, I wanted to ask you, what's on the future? I know you've only been in this location for about 12 months now. I mean, do you have future expansion plans? Are you taking over the chiropractic world in Maryland? Or
that would be the goal. Yes, that would be the goal. I mean, Annapolis is definitely on the horizon. Opening up a location there, and maybe even Severna Park. We'll see, but yeah, so Annapolis would be the next on the
baby steps.
Yeah,
absolutely. Well, thank you very much, and enjoy the rest of your weekend.
Thank you so much, John.
Thanks for listening to this week's Local Business Spotlight. Please make sure to visit eyeonannapolis.net for all your local news, events, and opinion. And in case you haven't already, please subscribe to the Eye on Annapolis Daily News Brief, where we bring you all the day's local news direct to your phone, tablet, or computer in about 10 minutes. It comes to you at 6 a.m. every Monday through Friday, and you can subscribe on Apple Podcasts, Google Podcasts, or wherever you get your podcasts.